Meeting. I will be officiating today. Our chair is on a much-needed vacation, and congratulations to her. I can see her, so she's at least present video, as well as our vice chair, Commissioner Scouten, who also is on a much-needed vacation. So third string is in. So we'll start from there. We have oral communication. I understand that this is limited to 10 minutes. We have two individuals.
Yes. If I may,
Yep.
Mr. Chair,
Go ahead,
I
call
will
the meeting
do the
order.
thing. The Board of County Commissioners of Washington County, also serving as the governing body of Clean Water Services, and now all other county service district is now meeting in regular session, July 7th, 2020. Commissioner Willie,
Here.
Commissioner Rogers,
Here.
Commissioner Treese,
Here.
Vice Chair Scouten,
Here.
Chair Harrington.
Here.
All right.
Great, thank you.
Yes, I will take care of that, Mr. Chair. Thank you. On the line first, we have Mr. Dale Feek.
Hi, Dale, can you hear us?
Yes, can you hear me?
And you're under the 2-minute one right now.
Thank you, Chair Rogers and Madam Chair Harrington, my Commissioner, District 4, Jerry Willie, and Commissioners. I made oral public comment during your special meeting on Wednesday, July 1st, and I emailed to you what I had said. So I assume you received that email. I am chair of the Washington County Citizen Action Network, Dale Feek. I'm going to summarize quickly. Joel Scarborough said that we're in the midst of a deadly pandemic that is going to be with us for a long time. He said, wear a mask, socially distance, and be responsible. Then Mike Barnacle said, if you take everything that has happened in the Trump administration so far, especially in the last 6 months, neatly sum it up in one phrase, it is dereliction of duty. Dereliction of duty. And then President Trump is now saying we need to just live with it, live with the virus. That is his advice to the people in the United States and the world. And that is, again, a dereliction of duty. I am so pleased that you as county commissioners are not following his advice. And in particular, that you're following the advice of the Director of Health and Human Resources and their staff. That's Marnie Kyle. And as you know, but I'm saying this for the public, just not for you, for getting published and distributed a poster that explains what people can do to protect others and themselves from the novel COVID-19 pandemic. The top of the poster says it all. Show your patriotism safely by wearing a mask, honoring social distances, and be responsible. So thank you, County Commissioners, for being leaders and having great staff.
Thank you, Mr. Feek. Who's our second presenter?
Second speaker, Chair Rogers, is Jeffrey Patello.
Hi, Jeff. Are you on right now?
Jeffrey, can you hear us?
Yes, there we go. I had to unmute. Can you hear me?
Please.
Jeff Petrillo, and thank you, Acting Chair Rogers and other commissioners. I reside at 16965 Northwest Bernietta Court, 97229 in the Bethany neighborhood, CP07, in District 2. I wanted to, I serve also as the chairperson of the Planning Commission, and as chair of that body, I wanted to be sure you were aware that at our last meeting on June 17th, the Planning Commission adopted a motion expressing support for the proposed charter amendment, the Chapter 10, Section 103 change, to change the land use ordinance season to a year-round affair. The long-range planning staff is actually preparing a letter to that effect from the Planning Commission addressed to the Board of Commissioners that will be shared with you. That will be shared with you prior to the meeting in late July. But I did want to preempt that letter by letting you know that the Planning Commissioners were unanimous and enthusiastic.
I will go ahead and send out the invitation to the 4 people that want.
I'm sorry, Jeff. We're getting some feedback. I think it's cut now. Go ahead.
Okay. I was just saying that long-range planning is preparing a letter from the Planning Commission to the Board of Commissioners expressing that unanimous and enthusiastic support for the proposed change in the ordinance, land use ordinance calendar year, and just feels it's in the interest of the public, and we appreciate the consideration of that. So thank you for your time.
Thank you, Jeff, and thank you for your service on the Planning Commission. I know you've been on there for a while, so we do appreciate it. Kevin, that's it as far as
Yes, that is, Mr.
folks on the
Chair.
phone? Okay, thank you very much. Is there anyone in the audience? I don't think for oral communication. All right. We have a consent agenda that's pretty customary for us. It's a small number of items today. It's A through F, a variety of topics. What is the pleasure of the board?
Move to accept the consent agenda?
Second.
Moved and seconded. Any comments, thoughts, questions? All in favor, say aye.
Aye.
All opposed? It does pass unanimously. Something new for us today. We've never had one of these, a COVID-19 update.
Health and Human Services. I turned on. Okay, so it's very similar to last week. Pretty short, but happy to answer any questions that you have. So we'll go ahead to the next slide. As usual, starting with our numbers. As of yesterday, we have just over 1,600 cases since February 28th. And 28 presumptive cases. And as a reminder, presumptive cases are people who have been directly exposed to a positive case, a lab-confirmed case, and they have symptoms. So they might be waiting for a test result or even have a negative test, but we treat them just like a positive case. And then we've had 166 hospitalizations and 20 deaths. The last half of this chart just shows the number of outbreaks in long-term care centers and in non-long-term care congregate settings, other workplaces, and then camps and daycares. We'll go to the next slide. Just to give you an update on what public health is doing. We talked a lot in the beginning about contact tracing and the surge staff, and from public health perspective, we said that the bulk of the work is going to be isolation and quarantine, because the folks that are in isolation or quarantine need support and they need daily monitoring. And as of yesterday, we had 564 households in isolation. And isolation is people that are positive or people that are symptomatic. And then we have an additional 511 individuals that are in quarantine, meaning they don't have symptoms, they've been exposed. 270 of those quarantine households are receiving basic needs support. That's a 60% increase from last week. 67% are Latinx and 40% speak a language other than English. And so it continues to demonstrate that our communities of color, in particular Latinx community, is impacted disproportionately. The other side of the chart, and it's a little bit of a squished chart, but it just shows the public health staffing. And this is our surge staffing that is working only on the COVID outbreak. So we have now a total of 127 staff. Last week we had 107 staff. So we've brought on 20 new staff on Monday. And this just gives you a little bit of a breakdown of the different types of work that these staff are assigned: case interviews, contact tracing, case investigation, our epidemiologic work, which is really the data crunching that helps to guide what the need is, where we need to focus our testing, and where we need to focus our support. We have strike teams. Those are the teams that when there is a workplace outbreak that's identified, that go into the workplace and work with the employers and employees to make sure that they're safe. And then we have special teams, which is the teams that are working with our community-based organizations and directly with families who are in isolation and quarantine.
Are there questions? I saw our chair was, nope, okay, fine.
Okay. Oh, sorry, I can't see, so you'll have
all
to
right. I'll
alert me. Okay, so what this chart shows is the case count over time since the beginning of the outbreak. You can see a small curve flattening in late March, early April with the stay-at-home orders, and then you'll see a steady increase beginning the first part of June when we started reopening. The trajectory of the curve is concerning. We are following the national trend, and we're seeing more young people, especially those in their 20s, who have been diagnosed over the last couple of months. The 7-day average as of yesterday, or I'm sorry, as of July 5th, was 43 new cases. That's 43 new cases per day is the 7-day average. So we'll go to the next chart. This chart
Marnie, we've been staying though, that's about 15%, am I doing my math correct? Our percentage of,
positive. We're
Positives
gonna get to that chart.
okay. thank you.
Yep. So this chart, so this one shows hospitalizations, and it's the daily count of hospitalizations for COVID. We declined from the high point in late March, but we have seen steadily more hospitalizations since late June. Although that number really, it's been small, it's still averaging 1 or 2 hospitalizations per day. So one number can change that. That's why you see a lot of, long and short lines on this chart. But we are concerned because we anticipate, because of the number of cases, that this will, just like we're seeing nationally, this number will start to go up, and we have seen slight rises over the past week.
Can I
Okay,
ask a question?
sure,
I know you can't see her, I'm sorry.
that's okay.
That's all right. On hospitalizations, and maybe you'll get to this, but I would like to understand at what point do we get to a, not crisis, but an indicator point where our healthcare capacity or our hospital capacity is at risk. I've lost sight of that.
So I don't have that off the top of my head, but I do know that that is one of the data pieces. We are monitoring daily our hospital capacity. So we look at number of beds that are available, number of ICU beds, and number of ventilators. And we haven't been approaching anything critical. We currently have capacity. I just don't remember what those numbers off the top of my head are.
But if we were starting to challenge our capacity or really tap into that capacity, you would be sending alarm bells.
Yes.
Thank you.
Yep. And the state would be sending alarm bells, especially in the metro area, because we have a lot of hospital capacity for other outlying rural areas in the state.
Marnie, excuse me, the hospitals in the metro area are still operating as they were in the early days as a coordinated unit around COVID. Is that
Yes,
correct?
yes.
Okay, thank you.
Yep. Okay, so just looking to make sure it is yes. So this is showing the percent of cases who are not linked to a known case within the daily case count numbers. So the black bar in the middle is the benchmark that's set by OHA, which is 30%. And ideally, we'd like to track every new case of COVID to an existing case, but with community spread, that's not possible. A lot really depends on the community's willingness to engage in case interviews and provide information to the callers. So we're really encouraging folks to answer the call. You may have been hearing this recently, and we are starting to get a little bit of pushback when our contact tracers are calling people and asking for information. But it's really vital that we understand, is this community-wide spread, or are these cases linked to known cases within the community? Since this is small, just wanted to point out the 7-day average for this is 49.8%, and the goal, remember, is 30%. So we're still a ways off on this measure as well. And of note, Oregon is also not meeting this benchmark statewide. Okay. Okay, so this chart is showing the percent of all tests that come back positive by the day. So that's the orange bar, and the line is showing the percent positive over the past 7 days. And that's the more accurate number to look at, because there have been some system-wide, statewide issues of processing the magnitude of negative tests at the state level that result in some artificial spikes in the percent positive. So if you look at it each day, it could be rather alarming. You can see that on this chart. But when we look at the rolling average for 7 days, right now we're at 10%. And you can see that that's an increase from the lows that we were having that were just under 2%. And so we have seen an increase in the positive tests. So it's still not in the direction that we want. Did that answer your question? Okay. Okay, and the next one. So this chart is showing the percent increase in cases over the past 7 days. It's comparing today's numbers to the previous 7 days. Here, we want to see this number continue to decrease, and the governor has set a goal that it should not go over 5%. And you can see that we're much higher than the 5%, and it has been steadily rising since early June when we reopened. The 7-day average as of July 5th on this chart is 23.5%. So not quite as gloomy as I was last Wednesday when we met, but you can see that our data is still pointing to concern, and we're not necessarily going in the right direction yet when we think about prevalence of the disease and community spread of the disease. So we can go to the next slide, but it looks like you have a question.
I'd like to know what your perception is about the impact of a holiday. When do we, how many days post-holiday do we see the impact of social gathering?
Right. So the incubation period is typically 7 to 10 days. It can be as much as 2 weeks. And so we really wouldn't expect to see the impact for at least 2 weeks, because the way that it works is maybe in 6, 7, 8, 10 days, you start feeling some sniffles, maybe some sore throat. Don't think much about it. Maybe 2 or 3 days later, you go to the doctor, and then it's another couple of days before you get the test results back. And so there's a delay even beyond the incubation period, because people need to decide that they want to get tested. And then there's the delay of really relating it to maybe activities that happened over that holiday weekend until we get that case investigation and contact tracing done. So it'll be at least 2 weeks before we can say
The end of July.
the end of July. Yep.
July 28th.
Yep.
Okay.
Yep, at the earliest. So this slide and the next one should look really familiar to you. Public health continues to implement our strategies with the goal of moving towards phase 2. I think we, like everyone else, would like to see the community healthier and able to participate more in our normal behaviors. I think Commissioner Rogers said this earlier. Those normal behaviors are still going to be slightly adjusted. We're going to continue to ask people to be physically distanced. We're going to continue to ask people to wear their face coverings and frequent hand washing and hand sanitizing, contact tracing, isolation and quarantine. These are extremely important strategies to help spread to help stop the spread of disease in the community. So we can't ask enough. If you get that phone call from the county, please answer those phone calls. Please help us to stop the spread so that we can move towards reopening by cooperating with the interviewers, providing the information so that we can identify other people at risk, so that we can help get them in quarantine, so that they're not exposing other people, get them the medical care that they need, and whatever support they need to stay home safely. We know it's tough for some people. They're just getting back to work, and then we're calling and saying you need to stay home again. We know that's extremely, extremely tough. And then we do continue to work to support the homeless population, migrant and seasonal farm workers, and other high-risk populations. You were asking earlier this morning about our ability to provide PPE to migrant and seasonal farm workers. And we have been able to get face coverings, the KN95s, as well as cloth face covering to both through the employers and directly to the migrant farm workers and seasonal farm workers themselves. We also have been providing food support, and Virginia Garcia continues to go to the camps and offer testing information and healthcare follow-up to those groups. So what we're hearing from the team that's working directly with Virginia Garcia and Central Cultural and the farm owners themselves is that we're hearing that that the needs are being met as far as food and PPE, and that they're feeling that they're following the guidelines that we provide.
Marnie, when you drive by on Highway 26, you can see the line of people waiting to get tested. Has that line, are the number of people being tested, has that increased dramatically at that location? And are we considering additional locations, or are we meeting the needs as it stands right now?
So I can get you information about the different locations. There's some on our website. I don't know specifically at locations how much there's been a change in testing. Overall, we have had significant increase in testing completed within Washington County. And then we've also been working with Virginia Garcia to do pop-up testing sites. So I think it's been maybe 10 days ago that we did a Pacific Islander focused testing site. And so we provide interpreters and culturally specific information to the Pacific Islander community, because we started seeing a little uptick in their number of positive tests, and that went really well. Obviously, the migrant camps were doing testing, and there's other sort of pop-up testing sites. There's also a lot of private sector testing sites that are drive-through sites.
I'd like to piggyback. I had two questions today, and I'll ask the other one later. But I was on a phone Skype meeting with former chair Tom Bryan, and he was mentioning that his cardiologist said that he had to have a COVID test, and they couldn't find any in Washington County, that the only ones were in Multnomah and Clackamas, and they were several $100s not covered by insurance. And I said, well, that's news to me, because we have these sites. So it might be good if you would reemphasize what you just said, that we do have these sites, and what's the cost if somebody drives up to them to get it? So if you could just say where these sites are, so that people get that information in their head, that there are out there.
Right, so what I can say, I don't have that information off the top of my head, but our website does provide information about where the drive-through testing sites are. Most people have been able to access testing through their private provider if they have health insurance, or including Medicare or Medicaid.
That's free, and that's free.
Well, if you
Covered
have
by the insurance.
Medicare and Medicaid, yes. If you go to a private testing, I can't think of there's some private for-profit testing companies now. They're not free. And
How about ours it's out off 26? Is that a cost to people?
I don't remember if that's OHSU or OHSU Tuolity, or if it's Providence, because they both have sites. Yeah, I think it's OHSU, and yeah. Yes, insurance.
Yeah, the only reason I mention it is.
Sorry, I can't remember
We
which
we all
ones are
think
where.
everybody knows all these things, but it took me back a little bit, and I'm saying, well, but we have these sites, and they
Yeah.
are covered by insurance from many cases, but
Yeah.
Chair Harrington?
thank you. Yeah, the Chair wants to say.
Chair Rogers, as Marnie has said, right on our website, if someone goes to our coronavirus webpage, there is a whole page dedicated to testing. So anyone who's saying that tests are not available is not having this experience. So it's incumbent upon all of us to continue to direct folks to the Washington County Coronavirus webpage, because our team's working extremely hard to make sure that we have good information available to everyone here in Washington County.
I'm sure there's probably people that fall through the cracks, because, OHSU is really for their patients and their networks. Providence is the same.
The
But-
takeaway is not that we don't do it, it's just that
Right.
we all think that because we're involved, that everybody understands, but maybe they're
Right.
sitting in their homes, or they're doing other things, and they're just not aware. So
Yeah.
maybe we want to add on your presentations that
Yep.
our sites and what the general cost.
We can do that.
Yeah, thank you.
Yep, I can do that. And then the last slide, again, you have seen this, and it's really, imperative to protect our family, friends, and our coworkers, that we continue to avoid crowds whenever possible. Just because some things are reopened and you can go out, doesn't mean that you have to go out or that you should go out. You should really think about whether it's necessary. If you do go out into public spaces, please make sure that you're maintaining that physical distance and that you're wearing your face covering. And any other questions, I'm happy to answer.
Questions of anybody? Questions? I have one final one. Something I have no idea on how to answer this.
Uh-oh.
A mask question. Some people wear masks, some people wear shields,
Yes,
and some people wear both.
yes.
So what's the guidance? If somebody's wearing a shield, which a lot of people think are better because it, protects your eyes as well. Not everybody wears glasses like I do. Can you just wear a shield without a mask?
Yes,
Wear a mask without a shield?
Yes.
And what's the highest and best, and what's your guidance?
so what the guidance is that you cover your nose and mouth. Some people wear shields because they're more comfortable. And some people, like you said, they like the fact that their eyes are covered. What I have noticed with masks is some people are doing this. That doesn't work. It's covering your mouth and your nose. And I don't have a shield to demonstrate, but what I notice with shields is that because they tilt sometimes, and people will wear them very tilted, and then, they're talking to you sitting down, and when it's tilted up, it's not really covering their mouth and nose. So it should be straight down. I think that what's really important to remember is that I wear a mask to protect you. When you wear a mask, you're protecting me. More of us that are wearing masks, we're all protecting each other. And so I think that's, helpful to remember. So covering your mouth and your nose. Some people choose to have both. It's a personal preference. It's, maybe it's helpful to have more than one. Anything that's keeping those droplets from spreading and spewing, that's the goal.
So if I could just recap for our viewing audience, a shield is fine if properly worn. You don't have to wear,
Yeah.
we're getting feedback in the auditorium from somewhere, but, so you can wear a shield, properly worn, you can wear a mask, properly worn,
Yes.
and if you so choose, you could wear both.
Yes.
But that's the official guidance.
Yes.
Okay, thank you.
Yep. Thank
Right.
you.
Commissioner Scouten?
Yeah, I noticed on the one slide about phase two, right now, I feel like phase two is just like, that's just not gonna happen for a while. I would just be, this point in time, considering these enormous problems in places like Phoenix and Houston, Texas, where they're making decisions about who gets to live and die. They have topped out their hospital system and their ventilators, et cetera. We can just stay in phase one and be able to stay there and not have to go back to phase zero. I almost feel like that's a victory. I mean, we're going to have to work really hard, and all of us have to be really serious just to be able to stay in phase one.
Yeah, along that line, Marnie, I was asked the other day when we're going to move to phase two, and they were saying in July, and I said, well, I don't think that's even feasible. We're barely passing 2 out of 5 right now. So do you think the general public is aware of the criteria for moving into phase two and how badly we are failing that criteria?
I don't have a very good sense of the public awareness. We have done a lot to try to help folks understand what the criteria is and why the criteria is important. We have information on the website. We do these updates every week. We provide a lot through social media, through Nextdoor, through Facebook, and other Twitter, and you can see I'm not a social media. I'm old, so I only do Facebook. And there's a couple of others that I know I'm missing, but we do try to get the information out there. And the data really, it comes from public health science that helps us to understand how significant the community spread is and whether we can control and reduce the community spread. So it's not just the numbers, and so we try to also talk about the significance of that. But most importantly, what people can do, because I know people are anxious to move into phase two and beyond. And the only way that's going to happen is if people do what they can do, every individual, because public health is doing everything we can do. But we need our public to answer the call when we call. But even more importantly is we need folks to wear those face coverings that we talked about, whether it's the plastic shield or the face mask. And we need people to physically distance. Hand washing, cleaning surfaces, all those messages you're tired of hearing from us, but they are very critical, and it is what is going to move us into phase two.
Chair Harrington?
Yes, thank you, Chair Rogers, Commissioners, and Ms. Kyle. I really appreciate the extent of the data for Washington County that you've been sharing with us in these presentations, as well as on the website that is specific to Washington County. What I'm finding in talking with folks in the community, as well as through social media, is that folks are looking for a summary table, in terms of, are we trending up? versus trending down or whatnot? Are we hitting the mark or not? So as Commissioner Willie mentioned, 2 of the 5 criteria for moving into phase 2, we're not meeting. But I'm also wondering, given where we're at, if we also need to have that summary chart to know how we're doing for just staying in phase 1. Because my sense is if we were to go back to that, I'm wondering if we might be at risk there as well. And this message that, we're all in this together, we're reliant upon one another. I think we need some tools, some communication tools for people to see the result of our connectedness. And at some point, I would like to see a summary table for all 3 counties for that criteria of 5. Given how bad the numbers are just for Washington County, I don't need to see it for a couple more weeks, but I would like to see that summary table that shows the 2 of 5 isn't being met.
Okay.
I appreciate that the viewing the Washington County Phase 2 criteria data gives us the detailed chart. But I think in terms of really driving the message home to our community, we're going to need that summary page in order to drive our community to that page so that they can see the result of their individual efforts lead to a collective situation. So that's the summary information that I've been asking for a couple weeks. I fully appreciate that you're giving us the depth of the information for Washington County, but I think each of the 5 of us is dealing with both detailed questions, which the current website provides, but also this snapshot so that folks can continue to get that reinforcement that we need to keep working on this. So.
Thank you, that's
I know-
helpful.
I
No,
know
that's
it's
helpful.
really hard, and I'm so grateful for you and your team and for addressing the 1,001 questions that we continue to have as we all live through this together. Thank you, Marnie.
Thank you, it's helpful. We'll get something.
Thank you. Any other questions?
Well, I feel the need for clarification. I think we're passing 2 and failing 3, actually, of the 5. Is that correct, Marnie?
I believe at this point, we're passing 1.
Oh, okay, so
Yes,
we have 4 to go.
yes.
All right.
The only one that we're passing is the contact tracing is happening within 24 hours. The last I checked yesterday, 99% of the time. And the goal is over 90%.
So it sounds like what Washington County as an agency can control,
Yes,
the amount of staff that we have to do the
Yes.
contact tracing hard work, we're
Yes.
passing.
yes.
But all the other community-controlled indicators, we're failing at.
Right, right.
And we need
Some
everyone's
are
help.
getting closer, but we're only passing the one that public health really controls with our contact tracing.
Well, the other reason to follow through with what the other counties are doing is that we are linked.
Yes.
And because we're linked, we should know where everybody else is as well. And that gives more information to our community.
Yes, and I can start bringing that in the summary table. I just, we've been discouraged by our own data, so at this point, really all 3 counties are basically in the same boat. In a lot of ways.
Oh, thank you. You became a nurse, you didn't think you'd be a statistician, did you?
No, in middle school, I was told I was horrible at math, and now I love it. Thank you.
Well, what did they know? Thank you so much. All right, we have a couple of action items before us. The first action item is introduce amendment to County Charter 10, Land Use Ordinances, Section 103. Alan, are you going to say
Yes,
anything?
Commissioners, I'll just do a brief staff report, and if I may, I just will do both of them together.
Okay.
Then I recommend that you have separate votes on both of those. So there's 2 charter amendments that are being proposed. The first one is the amending Chapter 10, land use ordinances on Section 103, and you heard from Chair Petrillo today that the Planning Commission supported that, and I appreciated that he said that because I just got the email this morning to remind me of that. I hadn't put that in my agenda sheet. I did mention that we had the Committee for Community Involvement had supported it, but it was good that the chair called and let you know that the Planning Commission also supports it. And the proposed amendment would basically just delete the Section 103 where it poses the limitation on the season on which you can enact land use ordinances. And so the charter provides that there shall be, you can have a hearing no earlier than March 1 of every year, and that you can't have an ordinance adopted after November 1 of the prior year. So there's this 3-month period, 25% of the year that you cannot enact land use ordinances, and it's been problematic. You know, we're a big county, we're a growing county, and we need to be able to adjust our land use plans and regulations to adjust for needs. So that's what how that's gonna be going forward. And pursuant to the charter and the amendment process, you have this introduction today, and if you approve it, you schedule a public hearing for July 28th, which is 20 days past today.
July what? 27th?
Excuse me, July 28th, I believe.
28th,
28th,
okay.
yes. And so, that's a fairly simple charter amendment. And the second one is to amend Chapter 3, the Board of Commissioners, Section 30, composition, terms, qualifications, and vacancies, and Section E. One thing I will point out from the last time you heard this on May 19th was the proposal I had in front of you there said that the salary commission that this is proposing creating would meet every even year. And so what I've recommended changing and what I propose in front of you is that it meets every odd year. That way you could, if this gets past the voters, then you'd be able to start it this next January. And so that's the change on that. And so what the proposed amendment does is the existing language has the salary of the chair shall be 80% of the salary of a circuit court judge. The salary of the commissioners by district shall be 40% of the salary of the chair. That salary process does not account for how many hours of the work or the level of sophistication needed for to run such a large organization as we have here. And so the proposal is that there will be a salary commission that is made up of 5 members who are qualified human resource professionals, and then by January 1st of each odd year, the salary commission shall meet and set the salary for the chair and the commissioners. And so, and then they shall document their basis for this. And so one method how this could work is, so the charter, as you know, is an overall policy document, and if the board so sees fit, they can enact an ordinance that really gives more flesh and blood to what that salary commission does and what they look at and what they consider. So, but again, this sort of sets that policy out there. And again, we're asking that there be a public hearing on July 28th. And also on July 28th, we will be coming back with a ballot title and explanatory statements for both of these. And so that both of these will be set up to be separate ballot titles that will be voted on in November. So if it gets voted on and approved by the voters in November, then it will be effective on January 1, 2021. So I think that's sort of the overall process that we're doing here and what we're looking at. And I just wanted to also point out that Commissioner Treese and Mr. Vidal has been helpful in putting this process together, and I've sent out the proposed ballot titles to them for the 28th, and so I'll be also working with Philip Branford on putting those together into a more polished form, and then I'll get it out to the rest of the board relatively soon after that, so you'll have some time to look at it before the 28th. Any questions?
Questions?
And on the 28th, that will include public hearing on this, correct?
Yes, there'll be public hearings on both of these items.
Thank you.
Questions on either Commissioner Scouten or? No? Okay.
No, I'm good. Thank you.
Okay.
So again, I'd recommend you take a vote on each one separately.
Okay, so item A, I should say, is the amendment to the county charter.
Chair Harrington?
Oh, she did, I'm sorry, I didn't see her.
Chair Rogers, I would like to make a motion that we adopt this proposal for a charter amendment and schedule a public hearing for July 28th, 2020.
And that's for the Chapter 10 Land Use Ordinance one?
Yes, first one.
Yes.
Okay, correct.
Second?
A second.
Discussion. Discussion? The only thing I would like to add, I've already said in the work session, I'm going to pose the next one, but this one is fairly rudimentary. I would tell you that what's changed on this, for those who wonder why we had this, was a person by the name of Jim Allison, who was very active in Washington County for a number of years, always believed that somehow in the dead of night that we were going to adopt something that the public didn't have an opportunity to comment on. As we've seen, we've got two commissioners on the line right now. Our technology has changed. It's year-round. And so the idea that there isn't going to be adequate testimony and adequate information is no longer relevant. So I appreciate that. I had many, I think Jim passed away years ago. I had many conversations with him. And we didn't agree on this particular item, but that's fine. I do agree that it needs to be changed. It's just 21st century, and it was a sign of the times, that's all. So if there's no other...
Chair
I'm
Harrington?
sorry, sure.
Chair?
Yeah.
I would also like to make the comment that I believe that this will provide or remove a roadblock to our being able to be fully effective and productive in addressing the land use needs of Washington County. Occasionally, there are times during the public comment period on ordinances where we may need to fine tune during the process with the Planning Commission as well as the Board of Commissioners. And removing this timeframe obstacle will enable us to increase our effectiveness. As each of the five of us knows, we continue to have limited staff resources to do this work. So we will continue to use our work planning efforts to most effectively identify what it is that what the topics are that we're going to be focusing on and doing that work. But it will enable us to be most effective in getting that work done within each calendar year. So that's really one of the reasons why I support this charter change. Thank you.
And again, just for the public, this is fairly administrative. It's not changing a whole lot. Any other comments?
Excuse me, I'd just like to make a comment here.
Please.
While it's administrative, I also think it's an indication of our interest in being customer focused, being client focused, and meeting the needs of our constituents as a whole. So while I agree it's administrative, it is an indication that we are in a position to make changes that meet what our county's needs are.
Thank you. Yeah.
Yep.
Just one more comment. This was unique in Oregon. No other county has this.
Yeah. I don't doubt that a bit.
Yeah. The only comment I'd make is that one of our most precious resources is time. And my goodness, as a county, we've grown to over 600,000 plus. We have a lot of land use issues. To take away a third of the year, because we were talking this under the current system, we can't take action on land use in November, December, January, February. So that's 4 months out of the year. So we can get a third of our time restored to us. We can avoid some of the last minute rushes and that we have typically had in late October. We can get work done in November and December to finish up things we've been working on all earlier in the year, and we can get a much earlier start. This is long overdue.
Yeah, technology allows us to do it now. That's great. All right, there has been a motion. It has been seconded. No further comments. All in favor of the motion, say aye.
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 Any opposed? I guess not. I heard 5 yeses, so that's it. The second item, you've already presented, Alan. I don't think there's any further comments you want to make?
No.
Is there a motion then for this one?
I'd like to make a motion to adopt the proposed charter amendment and schedule a public hearing for July 28th with regard to Chapter 3, Section 30, Section E.
Okay, and there's been a second discussion. I will have some too, but anybody else? As I mentioned before, go ahead, Catherine. You raise your hand.
Yes, in terms of comments, as Commissioner Rogers has noted in his long tenure here on the Board of Commissioners, Washington County has changed significantly. Just in the year and a half that I have served, I've heard Commissioner Rogers mention that the county has grown from being in the 200,000 or so folks to now over 600,000. We are one of the 3 now urban and rural mixed counties here in the Portland metropolitan area. I believe that one of the barriers to service that our folks throughout the county have in possibly running for the Board of Commissioners is the situation that it's very hard for someone to do this job without having a good full-time salary. I've heard from my district colleagues that in order for them to do the work of this agency with its county standard portfolio of services, as well as those unique to the fact that we have over 200,000 residents living in our urban unincorporated area, as well as serving as the Board of Directors for Clean Water Services, that we do need to remove this barrier. And I think the proposal, and I thank Commissioner Treese and our County Council Rapplier, as well as Commissioner Treese and Willie's policy assistant for bringing this proposal forward, that this is a very professional and well-proven technique to looking at how do we balance the needs of having a Board of Commissioners that can function to do this work, and also balance the needs of the agency and the community. So that's why I am supporting this motion in order to put this before the voters. Thank you. Those are my comments.
Anybody else other than me?
I'd just like to add that in moving this forward, in my view, this is a project, if you will, for the future. It is making sure that we are well positioned in the future to address the needs of our constituents. I feel very strongly about that. We are a county of over 600,000. We need to be meeting the needs of those people. We need to be able to attract people to run for office that can be compensated for their time put here. We also need to be attracting people of communities that we don't currently represent. And that's very important to me as well. So again, this is not an issue about today. This is an issue about the future and the positive future that Washington County has in the growth aspects that we're looking at right now. So thank you.
Commissioner Schouten?
Yeah, what I would say, in addition to the increasing load of meeting our constituent questions and needs and going to community events, there's also the issue of being able to be present at the regional level in a sustained basis with elected officials. Metro has grown a lot in recent years in terms of its responsibilities and is now involved in affordable housing, is involved just in more issues than it ever has been. So we need to be at that table. We're also have to work with our colleagues in Clackamas County and Multnomah County, all of whom are full-time commissioners. And we need to be at the table. It's the old line: if you're not at the table, then you're being served on the table. You're being taken advantage of potentially. We also, until recently, have not been as present as we should be for our size of our county in Salem in the legislature. It's hard to ask commissioners to come on an ongoing basis, which frankly, Multnomah County, for one, has been very visible. It's very visible in the state legislature during sessions. And the question has been asked sometimes, well, how about Washington County? We're very large. Everyone knows we're large, yet it hasn't always been able to show up. And we can have staff people there, but it's also important to have elected discussions on bills and agenda items. So, but that's yet another responsibility that we're picking up. We've got a larger government relations staff. We need to back that up also with additional presence in Salem, and not just in the legislature, but also we forget about the state agencies, the governor's office, and the rulemaking that goes on between sessions, all of which I think involves greater involvement in our part, and then the ongoing work that the Association of Oregon Counties does. It all needs more time. We can't ask people to put in that time without additional salary. That's commensurate to the time and responsibilities. Thank you.
Okay, thank you. As no secret to my four colleagues who are going to support, I'll be a negative vote, and the reason I'm a negative vote is for a number of reasons. And I certainly do not take exception to any comments that's made. I think we're all well-meaning people. We just have different philosophies. I tend to like a philosophy in which we don't have paid professional politicians. Metro runs without a full-time commission. The state legislature runs without a full-time senators and representatives. If we want to consider that, I say we have a charter review committee. We ask our CCI, all our CPOs, to chime in and make this very transparent and look at the whole governance issue through a charter review committee. We've done that historically. In this particular case, we're not. As far as the size, we have some very sizable businesses, everything from Intel to Nike to you name it. Their boards are not full-time boards, and it depends on whether you're a professionally ran organization or whether you're a policy-driven organization. And so, again, I take no exception to what my colleagues are saying and how they're reacting. I see the world very differently. And the view that I have is one of let's make this a thoughtful discussion with a charter review committee. Let them open it up and see what they're saying. Look at the alternatives on when we meet, how we meet, number of people who meet, instead of going through and passing this, which seems fairly harmless, and then coming back with an ordinance that's going to be defining this action. So I'll save my arguments. I just wanted to cover them, but I'll save those for the actual ballot election. But that's why I oppose.
Thank you, Commissioner. I would like to say that the boards of Intel, Nike, and other corporations of that size are highly compensated for it.
Not full-time. Yeah, but I understand. Anyway, I think we've all said what we're going to say. The motion's been made. There has been a second. All those in favor say aye.
Aye.
All those opposed, aye. So it passes 4-1. And that'll be on July the 28th. Okay, thank you. Kevin, do we have any oral communication of the 5
We
minutes?
do not, Mr. Chair.
Wow, that's a new one for us. Great. Board announcements. The only thing that our chair typically does is say that next week we have a extended work session. That'll be at 8:30. That's not a public meeting. You certainly can view it, and we encourage you to do so. And then we're back here on the 21st for a regular work session at 8:30 and 10 a.m. But because of COVID that we're facing, we're meeting in this particular room. And so that's both our work sessions and our regular meeting. Did I miss anything? Oh, listening session.
I just want to let the board know that I will be attending the first meeting of Impact of some months. It will be, no surprise, a Zoom virtual meeting, but that will be tomorrow late afternoon, and I will be there on behalf of the board.
Thank you, Commissioner Scouten. I was thinking that I needed to be your alternate there, so I appreciate that knowledge.
And then the staff, oh, that's not public. Okay. All right, anything else that I've missed? Motion to adjourn then. Thank you too for coming in on, seeing your faces. You look pretty well groomed and mannered for being on vacation. I don't look quite so good. You look pretty rough when I'm on vacation.
Move to adjourn?
Second.
There's been a motion, a second. All in favor, say aye.
Aye.
All right, see you later. Bye-bye.
Take care.
Bye.